So, function or action of calcium. So calcium help in bone formation. There are three messenger in our body. There are three second messenger which is uses calcium: If3 DEC, calcium calmodulin, and calcium itself. Atrium and SA node are the only membrane in the body which use calcium for depolarization. Okay, other cells membrane in the body use sodium for depolarization, but atrium and SA node are the only membrane which use calcium for depolarization. It also help in regulation of magnesium and enzyme, and calcium also help in the keeping the resting membrane potential of neuron. Okay, now let us explain one by one. So in bone formation, like if you see, this is osteoblast. The secretions is going to form osteoid, and this then osteoid is immature bone. When there is mineralization, which is occur with the help of calcium and phosphate and vitamin D, this is called mineralization. Then osteoid is converted into mature bone. This is how calcium help in the bone formation. Now atrium and SA nodes are the only membrane in the body which use calcium for depolarization. Okay, the calcium influx in the SA node and atrium cell membranes will lead to depolarization. Now there are the three messenger: If3 DEC, okay, and then calcium calmodulin, and then calcium itself. Now you see DEC, If3 DEC system. This is the second messenger. Now If3 DEC are used by all hypothalamic hormone except CRH, which is uses cyclic AMP. Okay, so now these If3 DEC need calcium. So for the release of all these hypothalamic hormone, we need calcium. Now If3 DEC is also the smooth muscles of the smooth muscle in the blood vessels and GIT, gastrointestinal system, also use If3 DEC as a second messenger. Now in the smooth muscle, by muscle contraction, for smooth muscle contraction, like by hormone and neurotransmitter. Now first of all, let's take GIT. For the contraction of GIT, we use acetylcholine, which is a neurotransmitter. We also use CCK, cholecystokinin, which is a hormone. So they are using If3 DEC as a second messenger. Now in blood vessels, there could be also constriction, which is by alpha-1 receptor. Now calcium calmodulin is also a second messenger. This calcium calmodulin can also cause smooth muscle constriction, but this would be by distinction. Okay, If3 DEC was by hormone and neurotransmitter, and calcium calmodulin is going to be by the by distension. Like in GIT, if there is a food feces in the GIT, this will lead to distension, and this distension will lead to contraction, and that is because that use calcium calmodulin as a second messenger. So food feces will lead to distension. In GIT, that will lead to contraction. In the uterus, okay, there is a fetus, and fetus have a weight, and that weight will lead to distension, and that distension will also lead to contraction of the uterus. Okay, now urinary bladder. If the urine in the urinary bladder will lead to a distension, and that distension will lead to a contraction. Now when this urinary bladder is full, there will be distension on the urinary smooth muscle in the urinary bladder. That will lead to a contraction, and that contraction is actually occurred by calcium calmodulin. Now the another one is calcium itself. Now calcium itself is a second messenger used by G cell in the stomach, which release the gastrin. Okay. Now another function is that it also needed for the clotting factor. Okay, during clotting, okay, this is the activated factor which have 2 carboxyl group, like vitamin K dependent factors. Okay, when the calcium bind with this during clotting, so it also help in the clotting. And regulation of magnesium, it also help in regulation of magnesium. Okay, like calcium and magnesium absorb from the thick loop of Henle, okay, with a sodium co-transporter. Now this is the sodium co-transporter. If our body have less calcium, okay, then with sodium calcium will reabsorb. If our body have less magnesium, then with this sodium magnesium will absorb. So from this we understand, if our body is low in calcium, then with this sodium only calcium will absorb, so it will lead to the magnesium will not reabsorb, so the magnesium will become low in our body. Now if our body have low magnesium, then with this co-transporter, this sodium, only the magnesium will reabsorb, and so as the magnesium absorb, the calcium will not absorb, so our body will become hypocalcemic, okay, because the calcium will become low. So this is how calcium regulate the magnesium. Now another one is calcium also stabilize the resting state of sodium of neurons, okay, sodium channel of neuron. Simply it prevent the spontaneous depolarization. Now If there is hypercalcemia, now it will stabilize this neuronal membrane from the action potential. So it means the action potential will decrease in this neuron. If there is hypocalcemia, it cannot stabilize the resting state, and so the action potential will be increased. Now